Let us begin second part. So in this second part of terminology related to labor, we are going to start the Leopold maneuver. So what is this maneuver? Actually this maneuver is done per abdominally, okay, and the patient's bladder should be empty before doing this test, okay, and the position is the patient should be lying in dorsal position with knee flex, means it is like sleeping. The patient should sleep but somehow their knee should be flexed, and the examiner should stand on the right hand side, okay. So there are actually four maneuvers. Let us see the first maneuver. In the first maneuver, not only in the first, of course in the first, second, third maneuver, the examiner should face the patient face to face, okay. So it is a face to face procedure, that the examiner should be towards the side of the face of the patient. But coming to the fourth maneuver, here the examiner should face towards the feet. Here he should face towards feet of patient, okay. So now let us start. What are this maneuver? The Leopold first maneuver is called Fundal Grip. So first maneuver is Fundal Grip. So what is this Fundal Grip? Actually it tells the lie that it is feeling any part of fetus in a longitudinal line. First gap is empty, then it is a transverse line. So that is actually Fundal Grip. Let me show this diagram. So this is actually the Leopold's first maneuver, where you will see the Fundal Grip. So in this Fundal Grip, the presentation will be firm, broad, irregular. There is buttocks. So this firm, broad, irregular part which you are feeling is the buttocks. So if the buttocks you can feel on the near to the mother's rib cage, then you can easily confirm that it is a cephalic presentation, because the head will be near to the pubic symphysis, right? So then you can confirm it is a cephalic presentation. Okay. Now coming to second maneuver. In the second maneuver, this is also called as lateral grip. Lateral grip. So first one is called Fundal Grip, second one is called Lateral Grip. This tells us about the position of fetus, its broad, smooth, regular and curved structures felt, that is the back of fetus will be felt, okay. And if small multiple knob like structures are felt, then those are lips. Let me show this. So this is the second maneuver, also called Lateral Grip. You can see here clearly we are putting our right hand on this side, back of you can see on the back of the fetus, whereas left hand you can see it is palpating the small irregular legs and hands of the fetus. So especially this second maneuver, you will be feeling this on left side. So that is on the positions like left occiput anterior position, left occiput transverse position, okay. And if the back is in right side, then you will of course feel right occiput anterior, right occiput transverse, okay. And here also you will feel the left occipito posterior, and also here right occipito posterior. All these are felt. Now coming to the Leopold third maneuver. So in the third maneuver, it is also called as Pavlik grip. So Pavlik grip is done with only one hand, okay. So till now we used two hands in the first and second maneuver, but in third maneuver you will use only one hand. It tells about the presentation of hard round globular structure felt, that is a cephalic presentation. That is, we are now going to palpate the head, okay. So move the head from side to side. So let me show this diagram. So this is the third maneuver. You need to move the head from side to side like this. So if the head is movable, then it is called as ballotable. That is, head has not yet entered the pelvis. If the head can't be moved, if the head is not able to move, then it is called as not ballotable. It is not ballotable, then this has already entered pelvis. So by this third maneuver, you will see whether the head has entered the pelvis or not. If it is ballotable, then it has not entered the pelvis. If it is not ballotable, then it has already entered into the pelvic cavity. Now coming to the fourth maneuver. So in the fourth maneuver, this is also called as a deep pelvic grip. Deep pelvic grip confirms the findings of third maneuver and it keeps the hands parallel to inguinal ligament. So let me show that. So like this we need to keep our hands parallel to inguinal ligaments and check the deep pelvic grip. This is the fourth Leopold maneuver. So here this deep pelvic grip, if the hands are converging below the head of the baby, head does not enter the pelvis, okay. But if the hands are diverging below the head of the baby, for example, let me draw, these are two my hands, okay. So like this, if they are converging means the head does no, baby still not enter the pelvis. But if the hands are like this diverging, then the head has already gone into the pelvis. Like this you can tell. So this tells about the attitude of fetus. So can come to know attitude of fetus by this method, okay. So this is about Leopold methods, 4 maneuvers. Now let us see what is sinciput, occiput. Already we know everything, it's just like a revision for us, okay. So sinciput is the part where frontal bones meet with the face. It lies just opposite to fetal spine, okay. And already I shown in previous videos, right. Then what is occiput? Also we know it is a part below posterior fontanelle and foramen magnum. It is lying on the same side of the fetal spine. So what is the relationship of sinciput and occiput, especially during fourth maneuver? So in the fourth maneuver, how you have this relation? This tells us about the attitude of fetus. If head is well flexed like this on physical examination, on per abdominal examination, the occiput will be felt at lower level and the sinciput at the higher level, because head is tilted like this, right. So imagine a baby is crying, then her head is going downward, then her sinciput will be at the higher level because she's doing like this, right. But whereas her occiput will be on the lower level. So let me draw this diagram to explain this. So you can see this is the head of the baby here and this is the body of baby, okay. You see now her head is flexed. So as her head is flexed, her sinciput, this is called as sinciput, this is called as occiput. So now what you will observe that the occiput is felt at lower level. You can see this is the occiput at low level. But if you see the sinciput, this is at a high level. So here you'll have eyes, right. So means this is a sinciput, this is a occiput. So what if it's low level? Sinciput, high level. So in extended head, what will be the position in extended head? So let me draw that. So extended means baby's head is like this here, okay, and the body is like this here. So this is called as extended. So in the extended head, here you will have the occiput, here you will have the sinciput. So now what you will feel is that is in deflex head on abdominal examination, occiput and sinciput are felt at the same level. So see here, this is a sinciput, this is occiput. So especially in extended head, this is extended, right. In extended head, the occiput is higher, sinciput is lower level. But if you see in the before diagram here, the highest level is for the here the eyes, right. So then the highest level is for sinciput here and the lowest level is for occiput. But here it has got reverse, right. The highest level is now for occiput, sinciput lowest level in the case of extended head. Now let us discuss in the case of deflexed head. Deflexed head on physical per abdomen examination, occiput and sinciput at same level. So deflexed head means like this. So like this, same level. Now note that the relationship of sinciput and occiput on per vaginal examination. In a well flexed head, occiput is easily felt in the posterior fontanelle, and in extended head, this is extended head, you can see example. The sinciput is easily felt because sinciput is now in vagina, right? For example, this is vagina. So if you put your hand from here and if you want to palpate, then you will palpate sinciput easily per vaginally in extended head. But in a flexed head, you can see here, if you put your hand from below like this, you are going to now easily feel the occiput in the case of flexed head. So this is flexed head, this is extended head. That's it. So this is very easy to understand. So by this we have completed the terminology related to labor.